So offloading wounds using felt is a really important part of managing patients with diabetes-related foot ulcers. So generally speaking, the felt will go either directly on the foot or into the shoe. It's important to note that the shoe should have enough space and room for the felt. So often we'll use a Darko wound healing shoe or a DH shoe or other shoes that have lots of room and soft uppers so we don't cause any rubbing on the top of the foot because of the felt that we're placing either on the foot or in the shoe. Podiatry felt comes in a variety of different thicknesses. So I've got two different thicknesses here today. So I've got 10mm felt, which is generally what we use in diabetes related foot ulcers. I've also got an example of a thinner felt. So this is about 2mm. So this felt is used for other reasons in podiatry, but generally we won't get an effective amount of offloading using that degree of felt. So we stick with the 10mm. If you need to reduce the thickness, you can actually just pinch and reduce the thickness by tearing off a layer. So the basic principles of offloading, wherever the wound is located, you don't want material to go. So in this case, we've got a wound, or multiple wounds actually. So we've got a first, a fifth, and a heel wound. So what I'm going to try to do is push up on the areas around the wounds to effectively take pressure away from the wound edges or the wound site. So the first scenario I'll go through is applying the felt directly to the foot. So it's important to have a really good pair of scissors so we generally use craft scissors, like the big red handle scissors you get from craft stores, or scissors like this, because the felt, particularly the thick felt, can be quite tough to cut through. So what I'm going to attempt to do is make a pad that goes up into this gap and around and down. So we'll be pushing up on the areas that aren't wound. So this one will be to the foot. So I'm going to sort of try and measure up here. So you can see I'm just trying to make sure I'm cutting the right shaped aperture. So I need one on this side as well. This does take a little bit of time and practice, but after you've mastered the basic concept, it's not too tricky. And often what you'll be doing is replicating what the podiatrist has put on in the clinic. So it's a matter of copying and pasting. Okay, so that's not looking too bad now. I'll just get rid of any right angles because we don't really like to have right angles on the foot. Now, an important step is beveling the edges. So it is a very important part of applying padding. If we don't bevel the edges, you can imagine you've got quite a big difference between the pressure on the foot here and no padding. So this is a way to sort of ease the pressure loading. So to bevel, we just put the felt on the side and take our scissors, and we're basically cutting at about 75 degrees. And you can see now we've got a nice beveled edge. So I'm going to do that around all of the edges. You can see you make quite a mess when you're doing that, but that's okay. Another way of beveling, particularly that bottom edge, is using what we call a pie crust technique. So you actually just turn the felt on the side if you want to give some extra beveling if you're concerned, and it looks a bit like a pie crust. Okay, see that there? So that would then just be directly applied to the foot. So we would have the wounds dressed, and then we would apply. So it has a sticky adhesive backing, okay? and then we would put Hyperfix or a similar fixation tape on top as well to hold it in place. So it's important to have the fixation because otherwise it can move around on the foot. So if I was to just say the patient needed to get their foot wet for some reason, or they had a preference for the padding to go directly into the shoe, what we would do, we would take the opposite approach, okay? So when we were cutting out the pad, I'd have the felt facing the foot and essentially conduct the same process, and then that would go into the shoe. So you might like to apply the basic principles of offloading to other areas of the lower limb. Sometimes we see pressure injuries occur on the medial or lateral malleolus. So a nice way to offload those using felt is either by making a donut pad or a horseshoe shaped pad. So that's a useful way to offload when the patient is either lying in bed or against any form of pressure. So these go directly on the skin, so it's important to prepare the skin around the wound, dress the wound, and then we will make a pad. So I'll just demonstrate a donut pad first of all. So I'm going to just cut a square. Okay, I just start by rounding it off. So we don't like any square or right angles in our padding, generally speaking. The human body doesn't have any right angles. That looks about right. So I'm going to bevel now. So just using those beveling principles from the last video. Okay, so that looks pretty nice. Now this is an important part. Just be careful when we make the aperture in the middle. The scissors are very sharp, so just make sure your fingers are away from where you're going to put the aperture. So I just start by pushing the scissors through, or sometimes if it's a bit tough, so those scissors aren't as pointy as I would like, you can fold it over and just make a cut in the middle. Okay, and then you can put your scissors through. Okay, and then we just round. So turn the padding around, move your scissors, and we'll get a nice little hole in the middle, and you can sort of bevel as you go as well. So you can see we've got a hole there now. So depending on the size of the wound will depend on how big your aperture is and how big the edges are. So that would be good for a very small wound, and we just apply that directly over the wound dressing. Again, we'd put fixation tape on top to hold it in place. Another way to offload a pressure injury or some areas of the foot as well is a horseshoe pad. So it's a very similar concept to the donut pad. We just cut a square, and what we're looking to do is create like a U shape. So we'll start with the actual aperture. Just remember to leave space for your beveling. So you do lose a little bit of space with your beveling. So that's sort of the approach we'd want to take there. So again, get rid of your right angles, round those off. Same at the top. And then we just bevel. So these are particularly useful in wounds on when people have bunions on the side of the wounds. So sometimes in rheumatoid wounds or wounds with gout that need offloading as well. But you can see that one would just sit there like so. But yeah, it can also be useful on this side of the foot. So when we have wounds here, sometimes we like to apply the little horseshoe pads as well. So multi-purpose. So one of the most common wounds you'll see in diabetes-related foot ulcers tend to occur underneath the first metatarsal head. So in this scenario, I just want you to imagine this wound here and just not think about the fifth and under the heel. So I'll show you how I would offload a wound in this location. So I'm going to apply the felt directly to the foot in this scenario. So I've pre-cut something that's roughly the right shape. So I'm just going to create an aperture where the wound is. You want it to be fairly close to the shape of the wound, so that's actually looking quite good. Then I'm going to follow the shape of the foot along the top edge. Okay, and we just use some bony landmarks. So the arch of the foot, I'm going to run down the arch of the foot, and then along that outside edge of the foot. So I'll just take it in a bit. So you can make the pad full length to go down to the heel, but generally we stop at the bottom of the arch, or where the arch begins. When doing these wounds, we get effective offloading doing the pad in that shape. So I'd simply bevel the edges. I'd probably do a pie crust along this edge, and then that would be set to apply fixation tape, and away we go. Sometimes if people have particularly high arched feet, we will add an additional pad in the arch, so shaped like a D. So it has a straight edge along here, and then we run a curvy edge like a D shape along there. So we'd fill the arch and then put that on top. So we can have up to 20 mils of felt on a foot, as long as that shoe has adequate space.